So if you look at it recently, this disease called rheumatoid arthritis has been increasing a lot. That is, it's not just about joint pain. This is what we medically refer to as an autoimmune disease. That means within our own body, certain specific cells form in our bloodstream that actively attack the muscles and joints, and these vital organs subsequently get affected. That's what is really. If you look at it, this is especially common in women. Particularly, the risk is higher in the middle age group, that is from age 30 to 50. But still, men and youngsters, meaning those above 15 years old, can also get it. The key factor here is if we detect this early and start treatment, the impact will be less and it can be treated more easily. If the diagnosis is significantly delayed, there is a considerable chance that we may have to take lifelong medication. Also, this unfortunately increases the chances of severe joint deformities and much more persistent joint pain. So now, how do we effectively detect this? And if it occurs, how do we properly treat it? That's precisely what we're going to see in this short and informative video. Hi, I am Dr. Soma Sundar, a distinguished spine orthopedic and health specialist. So first, let's see what exactly this is. We call this rheumatoid arthritis. Here, our immune system, the body's defense mechanism, becomes hyperactive and starts attacking our own body parts, specifically the synovium present in the joint. This attacks and causes swelling and damage. Because of this, you'll experience more joint pain. This is a progressive disease. So these deformities, meaning the structure of the joint itself, can change as the disease progresses. An interesting fact is that we often compare this with osteoarthritis, but actually there are a lot of differences between the two. Let me explain. If you look at why this has been increasing so significantly recently, the main reasons are clearly obesity and a sedentary lifestyle. Because our activity levels are quite low, this leads to chronic inflammation within our body, and that's a major underlying reason for this. It's definitely there. This is also the primary reason why everything gets worsened. The second important lifestyle factor is undoubtedly smoking. So what current research says is that people who smoke, for rheumatoid arthritis, it's at 140%. That's what they say. The next important factor is environmental factor. That is, recently pollution has increased a lot and we are all very, autoimmune response is very high and is getting triggered. Next, a common factor that everyone is experiencing in this period is stress for a long time. Because of chronic stress, our immune system gets affected and becomes hyperactive. This in turn has turned into an autoimmune disease. So let's look at what these symptoms are. First, you'll notice joint pains, especially in the joints like the knees, elbows, and fingers. These kinds of joints will have a lot of pain, particularly stiffness, and it will feel like it's not moving properly. The main thing to note is that, especially in the morning, right after waking up, this stiffness can last for 30 minutes, sometimes even up to an hour. The second important point is that the joint pain is usually symmetrical. That means instead of having pain only in your right knee, you'll feel it in both knees or both shoulders or both hands will have this pain. So that's what it's called. Apart from joint pain, this can also cause fatigue. You might often get fevers as well. This problem can even affect our heart and lungs, especially in advanced stages. Now, when we talk about joint pain, what is the difference between this and other types of joint pain or arthritis? The following points will be useful for you. First, arthritis that comes due to aging or wear and tear. When you look at that, it usually affects people who are older, mostly those above 50 or 60 years of age. If you look at it, this type of arthritis can start even before the age of 50. Secondly, with this arthritis, the pain increases the more you walk. If you take rest, the pain will reduce a bit. But with the type that comes due to inflammation, the pain is usually worse in the morning when you wake up. As you start moving and walking around for a while, the pain tends to decrease. Now, it's very important to find out whether you have this type of inflammatory arthritis or not. The sooner we identify it, the better. If we diagnose it early and start treatment right away, we can reduce the impact on the joint's activities. Sometimes we can even reverse the joint damage. This way, we can greatly prevent long-term complications and deformities. By detecting it early, we can not only reduce the impact on the joints, but also greatly minimize the effects on the heart, lungs, eyes, and other organs. So, identifying it now is actually very simple, mainly through a few blood tests. For example, there is a blood test called RF and another called anti-CCP. But the important thing to note is that for many people, even if these blood tests come back negative, there's still a chance they could have the condition. This special group of people is what we call seronegative. This can be the case for approximately 15 out of 100 people. Apart from comprehensive blood tests, if you carefully look at x-rays or perform an ultrasound examination, you can easily and clearly identify whether there's a significantly high chance of potential joint damage. Another extremely important point is if the symptoms appear and we accurately diagnose the disease within a crucial 3 months and then start treatment right away, the progression of this debilitating disease can be we can easily reduce more than 60% of it. Secondly, by making some lifestyle and dietary changes, we can manage this problem to some extent. Mainly, we recommend an anti-inflammatory diet. That means including healthy fatty fish like salmon, turmeric powder, and plenty of green leafy vegetables in your diet. This is very beneficial. Try to reduce foods that are high in sugars as well. Simultaneously, doing low impact activities like yoga, swimming, and walking can help increase joint mobility. Even if it only reduces the chances a little, for those who already have this condition, these practices will be very beneficial for maintaining their lifestyle. Make sure to maintain consistency. Aim for at least 30 minutes of activity daily. As I mentioned earlier, stress management, meditation, mindfulness, and breathing exercises really help reduce the weakness in the body, and through these, you can easily find relief. Now, I'm going to talk about an important main signal. Many people have a lot of myths. So let's discuss 13 important myths now. The main thing is everyone thinks that this mostly happens to very old people, but that's not true at all. If you have this, it can actually start anytime between the ages of 50 and 130. Secondly, we tend to think that as this progresses, the risk keeps increasing a lot, but actually it's the exact opposite. It's not even directly linked to age. Even if you just stay in bed all the time, the risk will continue to keep increasing. But if you stay actively engaged and physically fit, the impact of this will be much less significant for you. Thirdly, everyone naturally wonders whether we can effectively control all this through our daily diet. Diet can help you manage your symptoms to some extent, but beyond that, it definitely won't have any effect on the condition itself or its treatment. So, it's better to go for a specific comprehensive management plan for this. Now, if you are at high risk, are you at risk or not? That's precisely what I'm going to thoroughly explain with these three crucial points. Because, first and foremost, let's look at genetics. Mainly, this is often an autoimmune disease. So, if your parents or even your grandparents have had this condition a lot, then there's a significant chance you might acquire it too. Second, women, because of hormonal imbalances and the profound influence of these various factors here, at a slightly higher risk compared to men. Third, and a very significant factor is lifestyle. If you are currently obese, if your physical activities have noticeably decreased, or if you started smoking at an early age, then your risk is indeed a bit higher. So, even if there is a strong genetic component, there are certainly some practical tips to prevent it. For example, if you started smoking at a young age, you should completely quit smoking. That is a directly related and very impactful factor, very much so. Maintain correct health. Because our posture is correct, the stress on our body and joints will be reduced. So, even if this disease occurs, its impact will also be less. Thirdly, as I mentioned earlier, stay active. Since you are giving your joints good exercise, the blood flow to the joints will increase and keep your joints healthy and strong. Some diets, like those rich in antioxidants, as I mentioned earlier, vegetables and such in your diet should be increased. So, if you are prone to these kind of problems, make sure to follow this. Most importantly, have regular checkups, especially if you're above 35 or 50 years old, and particularly for women. If you have multiple joint pains, if your body has been aching for a long time, or if you're getting frequent fevers, it's better to get this test done and confirm it. As I mentioned, if you detect it early, it's easier to manage. Now, what symptoms do you have? Have you been experiencing joint pain for a long time? Do you feel more pain right after waking up in the morning? Especially, where are you experiencing this pain? If that's the case, consult your doctor immediately. Even if you don't have this kind of problem in your family, if any of your friends have it, share this information with them and proceed accordingly. Even if this sounds a bit scary, with early detection and lifestyle changes, it can be managed properly and easily. I have seen many patients who, by maintaining a healthy lifestyle and staying active, have been able to lead a healthy and active life for a long time despite this condition. So, without any problems, Choose a healthy lifestyle to protect your joints. If you like this video, like and subscribe. If you have any doubts like this, or if you have experienced something similar, share your experience in the comments. Stay informed, your life and your joints are in your hands. Thank you.